Good morning, I'm Maria Jesus Pascal, the Nurses Team Coordinator of Transplant Child. Today we are going to present nurses work in the ERN Transplant Child. First, Marisa Tejedor, our Technical Director, will tell you about what are the ERNs and how Transplant Child works, and then I will tell you what nurses can do in Transplant Child.
Hello, good morning. As Maria Jesus said, my name is Marisa Tejedor and I'm the project manager of Transplant Child. First of all, I would like to thank you for joining us today, and we are going to explain in general way what is a European Reference Network, the ERN. European Reference Network are virtual networks involving healthcare providers across Europe. The aim is to tackle complex or rare medical diseases or conditions that require highly specialized treatment. All the ERNs are connected through a dedicated IT platform that was developed by the European Union that can convene virtual advisory boards or medical specialists. This will allows health professionals to consult peer and seek a second opinion from a colleague. The advantages of ERNs are that by consolidating this knowledge across all the members, the ERNs will give healthcare providers access to much larger pool of expertise. This means a great opportunity for patients to get assessment and support on the best treatment for the condition, to harmonize this treatment across Europe, because the center of all the ERNs must be patients. Transplant Child is one of the 24 ERNs that were approved back in 2016. It includes both hematopoietic stem cell transplantation and solid organ in children. These children shift their primary disease to a chronic condition of immunosuppression to avoid rejection that is even more challenging in children. This approach, like a cross-cutting approach, considers transplant process common aspect in all the programs. Transplant Child excludes some activities, that is the allocation and access to organ for the purpose of the organ transplants. This is not included in the network scope. And one main thing is that knowledge is shared among the healthcare providers, but at the moment there is no movement of patients. Today, the ERN Transplant Child has 18 full members that you can see in the map. We have a representation of the main countries and the main hospitals that performs children transplantation in Europe, of 11 countries across Europe. This is the full activity that Transplant Child has among their members. Now we have new centers joining the network as affiliate partners. At the moment, we have members from Tartu University Hospital in Estonia, Children's Clinical University in Latvia, Medical University of Vienna in Austria, Centre Hospitalier du Luxembourg in Luxembourg, Semmelweis University Institute in Hungary, University of Zagreb, Croatia, and Stadt Mater Dei in Malta. This center will join not as full member because their activity doesn't allow them to be part of the network. And now it has just finished one call for joining new members to the network. We had these new centers joining soon from Turin in Italy, Madrid, Barcelona and Seville in Spain, Rotterdam in the Netherlands, Ghent in Belgium, Hamburg in Germany, Dublin in Ireland, Helsinki in Finland, Copenhagen in Denmark, and Oslo in Norway. The network is divided and is focused following the strategic lines that were defined since the beginning. We have these 6 strategic lines, that is the improvement in the healthcare of the patient, harmonize the evidence-based and safe clinical practice, research and innovation, spread the knowledge, professionals education and training, and quality and safety, always having the pediatric patient and their families as the center of the activities of the network. Each strategic area has an associate working group that develop the activities and tasks that we are committed to perform. Each of them have a coordinator who belong to the Executive Operating Committee of the network from Hospital La Paz in Madrid, and a technical director who belongs to any of the other members of Transplant Child, from London, Bergamo, Hanover, Karolinska in Stockholm, Coimbra, or Vilnius. This is the structure that we decide for the governance of the network. The main body is the board of the network, and all the full members take a place in this board. We also have the executive committee that coordinates the working group we talked before, and also the patients committee and the affiliate partners committee that have also a place in the board of the network. The technical secretariat is a transversal body that gives support to all the activities.
Our ERN wants to provide a transversal vision of the pediatric transplant process. The transplant-related cross-cutting aspects are closely related to nursing care, emotional and social health care, and health education. In these fields, the role of the nurses is essential. Related to each of the strategic lines and working groups we have already seen, nurses have specific objectives. The main objective related to the improvement in healthcare is to respond to the needs and expectations of transplanted children and their families. We can help developing together those programs, protocols, and support materials they are demanding because considered important for their quality of life, but they are not yet elaborated. Nurses can also collaborate in the development of clinical practice guidelines and participate in research projects as well as in meetings and working groups. The elaboration of education and training material for patients and families and for professionals is another excellent opportunity to create useful tools for our daily work. The development of programs and measurement tools that increase the quality and safety of nursing care is another interesting opportunity. Our participation in training activities of the ERN is, at the same time, an opportunity to improve our skills and share knowledge. And finally, to participate in dissemination activities is the best way to spread knowledge. As you can see, there are many different possibilities to collaborate and much work to do. We have asked the different members of the ERN through surveys elaborated by the different working groups about their priority areas of interest. The tasks of the different working groups has been structured around these priorities. In the case of the Patient Healthcare Working Group, the priority areas to work on are to develop a consensual guide for patients on the whole transplant process. We are currently finishing up the homecoming recommendations. We will send it to you shortly in such a way that you can give your feedback. We can also share cases through CPMS. We can share those especially difficult cases that seem to have no solution. Having the opportunity to hear the experience and opinions of colleagues from other expert hospitals can be a valuable tool in these cases. And we can also collaborate in clinical audits development. Last year's audit was about the post-transplant lymphoproliferative disease. This year it is about vaccines. The first step to develop this audit is to learn about the practice of each center in this topic. This information will be held through a survey that will be sent to the representative of each center. If you are interested in participating, tell us to send you the available information. Of course, you can also propose topics for other possible clinical audits. The ERN is finishing its first clinical practice guideline about immunosuppression. You can cooperate in next transition to adult care work. It is a topic closely related to nursing care, and it is important that nurses from different hospitals and countries participate in its development. Another very interesting contribution of nurses to the network is the sharing of nursing documents between different hospitals, care plans, protocols, guidelines, clinical pathways, etc. Research and innovation facilitate continuous improvement in patient care and health outcomes. It is important to open transversal lines of research related to nursing care, emotional and social health care, and health education. It is also important to research in the experiences and outcomes expected by patients. Our three priorities in this moment are to identify translational ongoing research projects in transplantation, to propose new research projects, and to look for teams of nurses interested in collaborating on these projects. The best and most efficient way to increase knowledge is to share nursing initiatives that can be implemented in other centers or may be of interest to patients from any country in the European Union. The training activities on which Transplant Child is focusing its efforts are, on the one hand, monthly e-learning sessions prepared by medical and nursing professionals from the different memberships. These sessions deal with some of the topics identified in the education surveys conducted in previous years. On the other hand, the annual course on pediatric transplantation. The next course will be held on May 14th in Warsaw. There will be general and parallel sessions for medical and nursing professionals. Of course, you are all invited to participate in this course. We are also trying to find out local and national education activities related with pediatric transplantation for nurses, organized in any of the member states of our network. In 2018, the Education and Training Working Group conducted a survey on the training needs of the nursing staff of the 18 hospitals in the network. These are the 8 gaps identified by nurses as their major education and training needs related with transplantation in children: conditioning and immunosuppression treatment, communication skills, patient and family care, sociocultural and psychological issues in transplantation, different issues about health education and health improvement in transplant recipients' long-term care, patient protection, the care of central and peripheral venous access, and the care for patients with stomas. Now you know our main gaps on education and training. We strongly invite you to prepare e-learning sessions about these gaps. These are the proposals of webinars that we have so far. The Centro Hospitalar do Porto has offered to prepare a session on psychosocial aspects in transplanted children. The Centro Hospitalar e Universitario de Coimbra is setting up a session about adherence to treatment in teenagers. And the Hospital Universitario La Paz will make a webinar about family empowerment in transplant care, post-transplant recommendations. And for our last working group, in terms of quality and safety, we are trying to implement the inclusion of patient-reported outcome measures in the care of the transplant children and their families. We are also trying to develop patient-reported experience measures at each hospital to learn about the experience of children and their families in relation to the health care they receive. And finally, we are trying to establish communication channels with patient associations to facilitate their participation. And from our side, this is all. We hope this presentation has helped to clarify what the European Reference Network for Pediatric Transplantation is and what the role of the nursing team is in this network. Do you have any questions?